The nurse is teaching a client in skeletal leg traction about measures to increase bed mobility. Which item would be most helpful for this client? Option A, television. Option B, fracture bedpan. Option C, overhead trapeze. Option D, reading materials. The correct answer is option C. Rationale. Focus on the subject increasing bed mobility. Also note the strategic word most. The use of an overhead trapeze is extremely helpful in assisting a client to move about in bed and to get on and off the bedpan. The nurse is caring for a client who just returned from the recovery room after undergoing abdominal surgery. The nurse should monitor for which early sign of hypovolemic shock. Option A, sleepiness. Option B, increased pulse rate. Option C, increased depth of respiration. Option D, increased orientation to surroundings. The correct answer is option B. Rationale. Note the strategic word early in the query and the word just in the event. Think about the pathophysiology that occurs in hypovolemic shock to direct you to the correct option. Restlessness is one of the earliest signs, followed by cardiovascular changes, increased heart rate, and a decrease in blood pressure. The nurse is caring for a client with terminal cancer. The nurse should consider which factor when planning pain relief. Option A, not all pain is real. Option B, opioid analgesics are highly addictive. Option C, opioid analgesics can cause tachycardia. Option D, around-the-clock dosing gives better pain relief than as-needed dosing. The correct answer is option D. Rationale. Focus on what the question is asking, the factor to consider when planning pain relief, and consider the client's diagnosis of terminal cancer. Around-the-clock dosing provides increased pain relief and decreases stressors associated with pain, such as anxiety and fear. The nurse is caring for a hospitalized client with a diagnosis of heart failure who suddenly complains of shortness of breath and dyspnea during activity. After assisting the client to bed and placing the client in high Fowler's position, the nurse should take which immediate action? A, administer high-flow oxygen to the client. B, call the consulting cardiologist to report the findings. C, prepare to administer an additional dose of furosemide. D, obtain a set of vital signs and perform focused respiratory and cardiovascular assessments. The correct answer is option D, obtain a set of vital signs and perform focused respiratory and cardiovascular assessments. Rationale. Read the question carefully. Note the strategic word immediate and focus on the data in the question, the client's complaints. Use the nursing process and note that vital signs and assessment data would be needed before administering oxygen, administering medications, or contacting the cardiologist. Although the cardiologist may need to be notified, this is not the immediate action because there are no data in the question that indicate the presence of pulmonary edema. While assessing a 1-month-old infant, which of the findings warrants further investigation by the nurse. Select all that apply. A. Abdominal respirations. B. Irregular breathing rate. C. Inspiratory grunt. D. Increased heart rate while crying. E. Nasal flaring. F. Cyanosis. G. Asymmetric chest movement. The correct answers are letters C, E, F, and G. Option C, because grunting occurs when an infant attempts to maintain an adequate functional residual capacity in the face of a poorly compliant lungs by partial glottic closure. As the infant prolongs the expiratory phase against this partially closed glottis, there is a prolonged and increased residual volume that maintains the airway opening and also an audible expiratory sound. Option E, because nasal flaring occurs when the nostrils widen while breathing and is a sign of trouble breathing or respiratory distress. Option F, because cyanosis refers to the bluish discoloration of the skin and indicates a decrease in oxygen attached to the red blood cells in the bloodstream. And option G, because asymmetric chest movement occurs when the abdominal side of the lungs expands less and lags behind the normal side. This indicates respiratory distress.